Welcome to Hannity. All right, now tonight it is clearer than ever. We're living through a transformational time. The world will never be the same. Events of the last month are having substantial and unprecedented impacts on our economy, our culture, and our way of life. But we're making progress for now and in the future as well, because the books are being completely rewritten on how we address pandemics. That includes travel bans, public-private partnerships, telemedicine, at-home testing, drive-through testing, 5-minute testing, antibody testing, bypassing draconian FDA rules, allowing choice. And that means off-label prescriptions and so much more. Now, tonight there is reason to be optimistic and reason to be hopeful. Dr. Deborah Birx, she'll be joining us in just a minute. We are inching closer and closer to beating this virus, to restarting the single most powerful economic engine in human history, and solving what is a serious public health pandemic. This is the president from earlier tonight. Let's take a look.
We're going to have a rough week. We're going to have maybe a rough little more than a week. But there's tremendous light at the end of that tunnel. I said it last time, said it last night. There's tremendous light at the end of the tunnel. There's so many things happening with therapeutics, with vaccines, with things that we really want. Deborah, Tony, they're all working so hard on this.
So tonight, I want to make one thing clear as we begin. We will get through this. We are the United States of America. And as we do, we need to also remember that the cure cannot be worse than the crisis itself. We cannot put paralyzing panic and over-practical precautions above Americans working, when now practical. Now, what does that mean? It means getting this country back to work, doing what we do best as soon as and safely as possible. It means doing everything we can do to find treatments and a cure. And like I've said, the idea of an economic task force seems like the right path to me. Bring in the minds like Art Laffer and Steve Moore and businessmen and women who understand Wall Street and Main Street. Also tonight, we have big developments on hydroxychloroquine. Dr. Oz is here with that. Also, as I said, Dr. Birx. But first, I have an important message for the governor of New York, Andrew Cuomo. Earlier today, Governor Cuomo announced that the state may have hit a plateau because new data now shows that new hospitalizations saw a sharp drop in just the last 4 days. By the way, we also know that predictions and models didn't live up to what they told us it would be. Significantly lower. That's good. Stocks surging on the news that the outbreak may be closer to a peak. And so we have never before witnessed a healthcare mobilization effort like the one we are witnessing now across the nation. The president has changed the rules on how we will forever fight pandemics here and worldwide. Frankly, Andrew Cuomo, all New Yorkers and the country should be thanking the president. See all of this? Because while Andrew Cuomo wasn't listening to his own health care task force that strongly recommended and say, you will need this, we can predict this is going to happen, and he did nothing, and complaining the president was taking action, delivering all the needed aid to New York, and by the way, and the country, Donald Trump came to the rescue of New York State and did what Cuomo should have been preparing for, what de Blasio should have been preparing for. 2 million surgical masks, hundreds of thousands of face shields, and yes, thousands and thousands of ventilators, over 5,000 to New York alone. And also building new hospitals in addition to the emergency hospital at the Javits Center, which is the largest hospital now in the country, originally not built for COVID-19. Now they're taking in COVID-19 patients. Now the president has also staffed the entire Javits Center with his personnel, our great military running that hospital for New York and for the governor who was ill-prepared. You have the USNS Comfort in New York Harbor, which will now treat COVID-19 patients as well. The lack of state and New York City preparations is shocking. After 9/11, after the first Trade Center bombing, numerous terror threats, knowing that New York State, New York City in particular, is the highest concentration of people in the smallest geographical area, making New York City the most vulnerable to any pandemic, as Cuomo's own healthcare task force warned him about in November of 2015 in detail. Let me tell you something about New York City. It has been an epic fail on all levels of New York government, state and city, a disaster. There's no excuse after 9/11, no excuse after being warned by a task force, and you had years to fix the problems. New York needs to know, while the president was, well, working around the clock to make available millions of doses of hydroxychloroquine. Well, all talk, no action. Governor Cuomo was putting up dangerous barriers between patients and doctors. Well, today, finally, Governor Cuomo was asked about the drug hydroxychloroquine. Here's what he said earlier today.
We've allowed usage of the hydroxychloroquine with the zithromycin pack in hospitals at their discretion. We had a 14-day limit on how much you could buy because so many people were trying to buy it. If the federal government increases the supply to New York, which they say they're going to do, then we could lift the 14-day limit. Anecdotally, you'll get suggestions that it has been effective, but we don't have any official data yet from a hospital.
Yes, Andrew, he's providing you the hydroxychloroquine, just like he provided you all the masks and all the ventilators and building the hospitals, now staffing the hospitals because you didn't listen to your task force. We've been calling on the governor of New York to immediately lift the pharmacy ban on getting this drug. In other words, pharmacies, because of an executive order of Cuomo, they can no longer fulfill a prescription for hydroxychloroquine if a patient and a doctor think that they need it. I wrote an op-ed this weekend for FoxNews.com. This should be a decision between the doctors and the patients, not Governor Cuomo or Comrade de Blasio. And as Dr. Oz will explain in moments, this is not anecdotal anymore. We are now beyond that point in spite of what the mob and the media is telling you. Countries all over the world are seeing positive signs, including in France and China and Turkey and India and Israel and many other countries in between. 73% of patients in Spain have been using it. But let me be clear. This is something to take when prescribed by a doctor. I'm not Dr. Hannity. My mother wanted me to be a doctor. I'm not. There are risks. Side effects could include headaches, dizziness, stomach pain, rash, and you should always make an informed decision with your doctor. This is about science. This is about being a medical doctor. It shouldn't be about politics. The federal government has tens of millions of doses and has made millions of doses available, even more this weekend, to the New York governor. Governor, I say it again, let the people of New York and their doctors decide, not you. And you're getting it for free. And I get it. I understand. We all want long-term trials, clinical trials. At the same time, as Dr. Oz has been saying, you go to battle with the army we have. We don't have time in the middle of a pandemic to have a 2-year clinical trial. Hold on, virus. We need a clinical trial. That doesn't work that way. Doctors all around the world are using it. We have more new, incredible data. Probably the single most, knowledgeable expert in the country on this. I'm going to get to that in a minute. And remember, Governor Cuomo, he failed to act on multiple fronts. This is the difference between talk and action. President built the hospitals. President sent the ventilators and the masks and the gloves and the gowns and everything that they didn't prepare for in New York. But Andrew Cuomo was warned all the way back, November 2015, what would happen if we had an influenza pandemic in New York and how he would need to act boldly. And they had an obligation, ethically and otherwise, to save the lives of New Yorkers by acting now. This is a foreseeable problem, as that study said. When it came to ventilator shortage, they addressed it explicitly. In November 2015, New York Health Department report read, quote, during a severe influenza pandemic, there is likely to be a projected shortfall of 15,783 ventilators during peak week demand, a shortfall of nearly 16,000 ventilators. Well, I saw this weekend, Cuomo had over his shoulder, he put up one of his PowerPoints that said, requested to purchase 17,000 ventilators, because he didn't request them at the time. He requested them like 3 weeks ago. Where was the response from the governor when his own health care task force told him he needed to do it? Where was his urgency after such an explicit warning that New Yorkers would die? Governor Cuomo refused to act. He did nothing. He didn't listen. He bought 0 ventilators. And get this, the cost to purchase the needed ventilators, yeah, it's expensive. It was only 0.4% of his 2015-16 budget. And to those of you who may want to criticize Sean Hannity, let me say this. I'm in Long Island in New York, ground zero right now. Born and raised here, lived all around the country, but my family lives here. thousands of New York cases on Long Island where I still live. People I know fighting for their lives in hospitals right around here that I can't go visit. After reading that report, I and every New Yorker needs to be furious. They need to be held accountable. You want a task force? We need one to investigate why Cuomo failed to act after that dire warning, why he prepared nothing. Why did de Blasio prepare nothing? After seeing the governor put up a wall between doctors and patients, well, I'm apoplectic. And everything the report predicted 5 years ago is now happening. This is that week that they were talking about. What we witnessed from the governor and the mayor, dereliction of duty. Remember on January 24th, he was saying the risks to New Yorkers are low. February 7th, claiming catching the flu right now is a much greater risk than anything that has anything to do with coronavirus. The fact is, Cuomo was warned over and over again, and he was wrong over and over again. I have more later in the show. Now we turn to our Facts Without Fear segment tonight. According to Johns Hopkins, the U.S. has now recorded over 10,000 deaths from coronavirus, with confirmed infections of over 350,000. Remember, with swine flu, that pandemic, we had 60.8 million Americans that, in fact, contracted that virus and that pandemic, hundreds of thousands hospitalized, and nearly 17,000 people sadly died there. Pandemics are scary, with the worst hit areas including New York right now, Detroit, and New Orleans. President Trump announced at tonight's briefing that FEMA has distributed, look at this, 11.7 million N95 respirators, 26.5 million surgical masks, 5.3 million face shields, 4.4 million surgical gowns, 22.6 million gloves. They now have available 29 million doses of hydroxychloroquine. They have now over 10,000 ventilators that they are distributing to states on a per-need basis. States like California, Washington, Oregon, all announcing that they're actually sending hundreds of ventilators from the federal stockpile to other states hit by the virus. These states, both led by Democratic governors, including Washington as well. They are to be applauded. And Oregon. Across the pond, we're learning that the UK Prime Minister, Boris Johnson, has in fact been moved to an intensive care unit as his symptoms sadly worsen. Our prayers are with him, the Prime Minister, our allies and friends in the UK, and anyone that's contracted this virus. There's also reason tonight to be hopeful, because tonight the key coronavirus model, which is a model, the IHME model, that you saw in the White House briefing room with the coronavirus task force, well, that has just drastically been shifted and changed and reduced in terms of their projected deaths from just a few days ago. They're now, remember, they were predicting over 250,000 people dead. They said if there was no travel ban, no quarantine, no mitigation efforts, 2.2 million Americans could have died. They're now down below 100,000. Now, that's more than, 150,000 deaths than they were predicting just days ago. And last week, again, predicting up to the possibility of 250,000 Americans dying. And that's not all. The model now predicts 140,000 hospitalizations at its peak. That's a decline of 121,000, almost half of what was expected from their model.